Britts-Care. Washing a patient is a daily returning treatment which requires a lot of energy of the caregiver as well as the patient. When a patient is unmovable or difficult to move, for example, he or she has a lot of pain, is laying in the ICU, doesn't like to be washed with water, is obese, or for another example, is in a home situation after an operation, washing a patient then becomes another challenge. Use 2 wash bowls, filling them with water, and walk them to the patient. Then wet the patient, use soap, rinse, and dry the skin. This whole procedure requires 4 to 5 times lifting and turning the patient. Patients can get tired from this method, not to mention the load on the back, shoulders, and neck of the caregiver can be significant. Another problem is that the bed linen can get very wet, which needs to be changed after the wash of the body. And the water dropped on the floor is also a source of bacteria and needs to be cleaned up. The used wash bowls then need to be collected and brought to the collection point for sterilization. The wet towels and reusable mitts also need to be collected and cleaned. This laundry cleaning is at a high expense for the institution, as they're charged per kilogram, and wet material weighs a lot more than dry material. The solution we offer is wash without water products. You can forget about all the products you have to use with the traditional wash method. Just take 1 package with the impregnated mitts. If desired, you can put the package in the microwave at 700 watts for 20 seconds. You can put more packages in 1 time in the microwave. Open the package and first check the temperature of the mitt. Use for each part of the body another washing glove. Left leg, left arm, right arm, face and chest, back, buttocks, and perineum. If you only use 4 washing gloves, close the package well and leave the package with the patient to avoid cross-infections. With this washing method, you only need to lift and turn the patient once. Fluid in the mitt will evaporate and leaves the skin soft and in a healthy condition. After use, throw it away with the normal garbage. Both the patient and the caregiver will have more energy and feel less tired. A wash of the patient with our wash without water products takes less time in comparison with traditional methods. Tradition will take approximately 30 minutes, and this method would only take 15 minutes. Next to the mitt, we also have impregnated wet wipes. The functions are the same. The liquid is only then impregnated in the wipes instead of the mitt. We would like to summarize the advantages of this concept. Less pain and strain on the patients. No cross-infections. It's more hygienic. No leakage on the ground. Improvement of skin condition of the patients as well as the caregiver. A reduction of back, neck, and shoulder loaded of 25%. Time reduction of 65%. Cost saving. A lot less laundry to clean. Plus, it's environmentally friendly. Saves 10 liters of water per patient per wash, besides heating up the water. Advised to use on oncology units. Britts-Care. When a patient isn't movable or is difficult to move because he or she has a lot of pain, is laying in the ICU, doesn't like to be washed with water, or obese, or for example in a home situation after an operation, washing a patient then becomes a real challenge. To wash the hair of a patient, it can become very difficult and time-consuming. Due to this, it isn't always being done, and patients will feel themselves becoming more ill and uncomfortable with greasy hair. If the caregiver washes the hair of a patient, the top end of the bed needs to be put down, and the head needs to be placed in a kind of wash basin. This requires a lot of energy of the patient, and next to that, everything around it will get wet and needs to be cleaned afterwards. As well as the liquids being dropped on the floor, they become a source of bacteria. After the wash, the towel, bed linens all need to be collected and brought to collection point for cleaning and sterilization. The solution we offer is wash without water products. You can forget about all the products you've used in the past with traditional hair washing methods. Just take 1 package with an impregnated shower cap. If desired, you can put the package in the microwave, 700 watts for approximately 15 seconds. You can put more packages in one time in the microwave. Then open the package and first check the temperature of the mitt. Place the cap over the hair of the patient and massage for approximately 2 minutes, the outer side of the shower cap. Make sure that you reach the skin of the head to remove all the grease and dirt. Remove the cap and then throw it away in the garbage. The hair can then be combed easily as the shower cap does contain a conditioner. With this washing method, the patient can remain laying or sitting on the bed. Fluid in the hair will evaporate and leaves the hair clean and in a healthy condition. Patient and caregiver will be less tired and have more energy. A wash of the patient with our Wash Without Water products takes less time in comparison with the traditional method. Traditional will take approximately 30 minutes, as this method will only be 2 minutes. The shower cap is part of our complete range of impregnated washing products to wash without water. We would like to summarize the advantages of this concept. A lot less tiring and less painful for the patients. No cross-infection. More hygienic. No leakage on the ground. Improvement of hair of the patient. Reduction of back, neck, and shoulder load of 25%. Time reduction of 85%. Cost saving. A lot less laundry cleaning. Environmentally friendly. Saves 10 liters of water per patient per wash besides heating up the water. Advised to use on oncology units.